Good morning. I'm a few minutes late. We've got people here that are working on our phones. So if you hear some static or whatever, they're on their speaker phones and whatnot in the other room. So I apologize. Welcome to Friday's Lunch and Learn with me, Dr. Polly Heil-Mealey, and I am going to be discussing dementia, anxiety, depression, and all that kind of stuff. So we've got different products to share with you today, and I've got different components to share with you, and I think that everybody who is over a certain age is going to love this program, and I'm very happy to bring this to you because anxiety is such a big deal for us. And so in the clinic, we have a lot of people that come in daily, weekly, who are dealing with anxiety. And it may not be the full-blown, anxiety panic disorder, but it is something that it is concerned. It concerns them, it concerns their health, and anxiety and stress can have a lot of impact on your health. So I just want to go over that with you. Now, I see there are a lot of people that have joined, but I don't see any names. So I don't know if Facebook is just being crazy or whatever. But anyway, welcome and thank you for coming. If by any chance we get cut off, then I'll try and get reconnected with you as soon as I can. So we're going to be talking about some statistics here. So according to WebMD, right, doctor's visits for stress-related illnesses and complaints, they work up to an industry high of $300 billion. $300 billion a year in medical costs that are related to depression, anxiety, and that kind of thing. So this is including prescriptions, doctor visits, absenteeism, insurance costs, and all that kind of stuff. So $300 billion. Just let that sink in for a minute. We could really help with the national debt if we could get everybody to be very calm and in a zen state. So there are negative health effects, as I alluded to a moment ago, of stress. They are suppressed thyroid function. Now, everybody knows, if you've been watching, hi, Christy, everybody knows if you've been watching my stuff for a while, that we know that 80% of women are experiencing subclinical thyroid issues. So suppressed thyroid function is a negative stress thing. Blood sugar imbalances, lowered immunity and inflammatory response in the body is all from chronic stress. Increased abdominal fat, which may be associated with heart attacks, strokes, and the development of higher levels of LDL, lower levels of HDL. Now, back to the cholesterol issue. Not all cholesterol is bad. In fact, I don't think any cholesterol is bad. I've heard doctors say that people die from low cholesterol, not high cholesterol, although there's a lot of information out there. There's some misinformation. So while we don't want your cholesterol level to be too high, I'm happy if it's around 200, 240. I'm happy with that. Your LDL is an inflammatory response, and so if you have a lot of LDL, then we need to see what's going on, what is irritating you. If your HDL is low, that is because of a compromised liver issue, so we need to look at that, right? Obsessive compulsive disorder and anxiety disorder, and also sexual dysfunction. All of those can be linked back to anxiety and depression, okay? So we need to know kind of what's going on with that. So chronic stress and anxiety may show up as tension headaches, right? May show up as migraines, difficulty in going to sleep, upset stomach, changes in appetite, tightness in the chest, okay? All of this has to do with anxiety. So we don't want anxiety there. So here are some really good products. They're called nootropics. So I want you to look that word up, Nootropic. Nootropics are substances, plant-based substances that help the brain work better. It works on formulating neurotransmitters. Now, your neurotransmitters are all the chemicals in the brain that help you to do what they need to do. They fortify, they feed and fortify the brain. They support optimal brain function, reduce age-related mental decline. Now, this is something that I really want to focus on today because I don't know if you've noticed, but a lot of our older people are depressed. And so I know depression goes across the spectrum. We have kids depressed, we have adults depressed, but we have older people that are depressed too. So these nootropics help reverse, yes, I said reverse, aging mental decline. So this is one of the things that I do not want. I do not want to get old and have a brain that is not working for me, right? And so these nootropics that I'm going to talk about today, they help with that. They also give you increased physical performance and stamina. So vitamin C, we want to look at that. We all know vitamin C is good for the immune system, but if you have vitamin C at 1,000 milligrams a day, it's going to help you with your mental depression. You're not going to be as depressed. Vitamin B6. Now, vitamin B6 is the adrenal vitamin. Now, your adrenals are the little hats that sit on top of your kidneys. You have 2 of them, and it is the place where you have your fight or flight response. So when we are scared, when we are nervous, when we are frightened, when we are anxious, those adrenals kick out a lot of cortisol. Now, cortisol is a stress hormone. If you have too much cortisol, you're going to have a lot of belly fat. So we don't want that. So when we're working with you here in the clinic and we are dealing with the adrenals, we're going to give you a lot of vitamin B6, okay? So vitamin B6 plays a key role in metabolism, energy production, as well as making neurotransmitters, serotonin and norepinephrine. It is the basis that is necessary for hormones, red blood cells, and immune cells, okay? Now, you younger women, you're going to like this. In a recent double-blind study, right, over the course of 3 menstrual cycles, 94 women, 80 milligrams of vitamin B6, they found that their mood, PMS, and negative depression all around their menstrual cycle was totally abated due to the neurotransmitter effect of the vitamin B6. Now, I misspoke a while ago. I said that's good for it's the adrenal vitamin. That's B5. I apologize. So y'all don't beat me up on that. Okay. So GABA, now I want to talk about GABA, G-A-B-A. It stands for gamma aminobutyric acid. That's why we call it GABA, because that's just a mouthful. I love GABA. So in your brain, think about your brain. You've got GABA, epinephrine, norepinephrine, acetylcholine, serotonin, dopamine, melatonin. Okay, may not be in exactly that order. Melatonin, I think, is at the very bottom of the food chain. GABA, I know, is at the top of the food chain. If you supplement with GABA, that GABA is going to feed all the other neurotransmitters. So GABA is a great, great product. We have a pre-formed GABA product here. This little white bottle. And it is amazing. It crosses the blood-brain barrier. We use this for sleep. We use this for anxiety. We use this for a lot of things, and it is just a miracle product here. We love this. So GABA is an essential amino acid for your health, but it's classified as non-essential because your body makes it. But if your body doesn't make enough of it, you could be subject to depression and anxiety. So if GABA is low, you are irritable, you don't sleep, you can have seizures or other disorders, right? Low GABA or decreased GABA in the brain can lead to a lot of psychiatric disorders, neurological disorders, including anxiety, depression, insomnia, and epilepsy. So a natural source of GABA was found to produce relaxation indicated by the improved brain wave patterns in the patients, okay? So GABA helps reduce stress. Now you can get GABA in a prescription, I think it's called gabapentin, but ours works way, way better with none of the side effects. So we have that here in the clinic, which I love that. There is another amino acid called L-theanine. Now, L-theanine is awesome because it increases the brain's dopamine, serotonin, and GABA levels. Do you know Parkinson's disease is because of low dopamine? So if we can get these neurotransmitters up, then we're able to avoid a lot of these elderly diseases. Now, you chocolate lovers are gonna love this. L-theanine plus caffeine, right, makes your brain significantly faster, more focused, and you can process information with less stress. So researchers observed that the L-theanine and caffeine group had significantly greater alertness, higher accuracy, and improved focus when performing tasks. So if you like chocolate and coffee, this would be a good herb for you. So we have a couple of products that have all of these herbs in there, so you don't have to buy tons and tons of products, but you might just need one or two of these things, and we've got those as well. So just gonna throw that out there. Ashwagandha, I'm totally sold out of, but ashwagandha is an adaptogenic herb. Now, adaptogenic herb means that it will adapt to whatever you need. So if you need more of something, it will give you that. But if you have too much and you need less, it'll do that. It's adaptogenic. We love adaptogenic herbs. So this is an effective adaptogen that enhances the body's natural defense against disease by improving cellular mediated immunity. So what am I saying there? If you have an autoimmune disease, you need to take a lot of ashwagandha because it improves cell-mediated immunity. Cell-mediated immunity is your innate immune system. So if you need to go back and look at those videos, then you can do that. So additionally, when you take ashwagandha, your serum cortisol levels are substantially reduced. So if you are an insomniac, you just can't go to sleep, you might take 40 or 50 drops of ashwagandha before you go to bed and see what happens to you with that. In patients with Alzheimer's disease, now hopefully nobody out there has that, but if you have or know somebody that has Alzheimer's disease, the neuritic atrophy and synaptic loss are considered major causes of cognitive impairment. In a study published by the British Journal of Pharmacology, right, they demonstrated the regenerative effects of ashwagandha in neuritic atrophy and synaptic loss. What does that mean in plain language? That means ashwagandha goes into the brain, it repairs the nerves, it repairs the synapses. So if you've got somebody in your family that is dealing with dementia, Alzheimer's, Parkinson's, anything like that, ashwagandha would be a great, great herb for you, okay? So ashwagandha, 300 milligrams daily for 60 days, right? There has been reported improvement in social functioning assessed by the General Health Questionnaire. Okay, so patients that did the ashwagandha for 60 days, they improved 68% on their social functioning. So these are Alzheimer's patients, right? So social functioning, what does that mean? They can't remember, they don't know who you are, and that kind of thing. So if you can give them ashwagandha and that improves 68%, I think that's just a great, great deal, okay? Rhodiola is another herb, and patients are taking either 340 milligrams or 680 milligrams a day. And it is extremely effective in reducing anxiety, boosting mood, okay? It slows down the breakdown of various neurotransmitters, and it increases the serotonin levels and reduces cortisol levels. So what does all of this mean? This means that when we are stuck in chronic stress, when we have the deadlines, we've got to run here and there after the kids, we're the soccer moms, we may be older people that are running their own business and all of the ick that entails. I mean, this week, just so you know what we've dealt with this week, and there are very high stressors. We've got to have a new phone system put in and calibrated. That's what they're doing right now. Our printer went down. We couldn't do any printing except with a very old travel printer that we use when we go out of town. So printing was a big deal if anybody needed something printed or we needed to copy your blood work or whatever. And then somebody hacked our bank account. And so I had to go and spend a lot of time at the bank this week and get all that sorted out. So we've had a lot of stress. Stress is part of the American landscape right now. We're in election season. It's the midterms. So there's all kinds of stress going on. So everybody needs these stress herbs. And yes, I have been taking some. So we just need to know that that's right. In 2008, participants of a anxiety disorder program at UCLA took Rhodiola for 10 weeks. Their test showed significantly lower levels of anxiety compared to the baseline. Now, what does this mean for you if you have kids with ADD, ADHD? This means that if you give them ashwagandha or you give them rhodiola, which are very, very good, clean, pure herbs, they're going to have all of those neurotransmitters that they need, and their behavior is going to improve. Their brain's going to calm down. You're going to have just a lot of good things that work with that. Let me see, where are we here? Okay. In 2007, so this is a little bit older research here, 120 adults participated in a study, and all of the participants were noted to have physical and cognitive dysfunction, so in their brain and in their body. So these are older people. The participants were divided in two groups. One group receiving 2 capsules of rhodiola and the other one receiving 1 capsule at breakfast and at lunch. Okay, so significant rates of improvement were observed, both physical and cognitive, in all 120 participants. The group taking 2 capsules after breakfast experienced greater benefit than the other group that took the divided dose. So in this particular study, the researchers concluded that treatment was effective for over 80% of the population. And if you gave them a therapeutic dose first in the morning, you were going to have a better outcome than in the afternoon. So what does that mean? If you're ADD, if your kids are ADD, their brain is just functioning and firing in all these different directions, you're going to want to take some of these products, because these products are going to bring that brain into focus. It's going to recalibrate those neurotransmitters, so you're going to get to the cause of the problem. You're not just going to alleviate symptoms, which is what your medication is going to do. So, acetyl L-carnitine. Now, we use L-carnitine in our weight loss program. Acetyl L-carnitine is a little bit of a different formulation of this. It's an amino acid. So, acetyl L-carnitine is shown to maintain, and you're going to write this down, brain-derived neurotropic factor. Now, you're going to see this in the literature. It's going to be abbreviated as BDNF, brain-derived neurotropic factor. That's a lot of words. It helps to regenerate new brain cells. So all of us older people that feel like we're losing it, acetyl L-carnitine, which I have, ta-da, right here, okay, it has been proven to regenerate brain tissue. So I love that. It also repairs damaged cells. So if you've had a stroke, you've got damaged cells, if you've taken illicit drugs and you've damaged your cells, this is a product that actually goes in and builds new cells and repairs old cells. So BDNF, remember, brain-derived neurotropic factor, has been shown to prevent and reverse Alzheimer's disease. This was done by University of California, Irvine campus, okay? They demonstrated that the acetyl L-carnitine supplementation not only stops the progression and the inflammation, but it also stops free radical damage. Okay, Christine, I love what you say. Yes, younger ones need it too. Our brains get full. We are all stressed. This is amazing. I had no idea. I mean, I knew it was an amino acid. I knew we needed it. I had no idea, and so I started doing this research that it could actually repair damaged brain cells. Now, I'll just be honest with you, I did not do recreational drugs. I've not had a seizure. I don't have Alzheimer's, or if I do, nobody's told me, so I'm not dealing with any of that. But what a great thing to take on a maintenance dose, just maybe one a day. Let me see, on the thing, 1,000 milligrams. 2 capsules. So 1 capsule is 500 milligrams. How many milligrams did they say you needed? Let me see. It doesn't say. Okay. So the University of Siena says that acetyl L-carnitine can serve as a natural antidepressant. Their findings show that acetyl L-carnitine increases the production of 2 key neurotransmitters, serotonin and dopamine, while enhancing brain plasticity. So, what is brain plasticity? Well, it is the way that the brain is able to receive and make new connections. So, you know how they say you can't teach an old dog new tricks? That's because they've lost their brain plasticity. So, if this recovers that, then you are going to be able to teach old dog new tricks, because you're going to be able to learn things very easy. So if you are of a certain age and you find yourself frustrated with new technology and all that kind of stuff, your acetyl L-carnitine is maybe what you need to help regenerate neurotransmitters and regenerate brain cells so that you have that brain plasticity to learn new things. So I'm really excited about this. This University of Siena says that new long-term benefits of ACL can help retrain your brain to form new patterns of functioning. So I love this. I love this. So just to review, we've got the preformed GABA, crosses the blood-brain barrier, great for anxiety, great for tremors, great for sleep, really good. We've got the acetyl L-carnitine all by itself, and it's really good. We've got something called Lysozyme Forte. This is phytochemically bound lithium. I love this product. We give this to our anxiety people, and it is amazing. They love it. They come right out of that. And then we've got this product. It's called Curamed Brain, and it's got a lot of these things in there. And what it does is it clears up the beta amyloid plaques. Now, beta amyloid plaques are what you get in your brain when you have Alzheimer's disease. And so this product specifically goes after those tau proteins, those beta amyloid plaques, and it takes care of them. So also does this product. Now, this is just a sample size because I'm all sold out, but this particular one has every single one of those components that I just listed. They are at a therapeutic dose. On the bottle, it's going to say take 2 once a day, but I'm going to tell you, you're going to want to take more of that if you're suffering from stress, anxiety, if you want to have your neurotransmitters regenerated and that kind of thing. It's 100% plant-based. It's got enzymes in it to help everything work the way it needs to. So you've got a lot of stuff that you want to be thinking about with anxiety and depression and cognitive decline. Now, I'm not one that suffers from anxiety and depression very much. And to the best of my knowledge, I'm not suffering from mental decline. But that is one of the things, one of the aging things that I fear most, is that I will not just have a very fast functioning brain. I look at different people, not people that come to see me because their brains all work very well, but I look at different people who are older than me. Of course, I'm in my 60s now, now, so I'm getting up there, and they're just not functioning on all cylinders. So I'm so happy I did this research to find out that a lot of these products we give people for depression actually helps retrain the brain and revitalizes the brain with the neurotransmitter. So I absolutely love these products, and so I can't wait to share them with you. If you have any questions, let me know. And we will have the big bottle of this product. It's called Rezen, R-E-Z-E-N. Remember we talked earlier about Zen, getting in that Zen state of not being anxious. So I love these things. And so let me know what you think. And thank you for joining me. Enjoy hunting season. If you are a hunter, hunting season in Texas started, certainly where we have our farm, it starts this weekend. So I know people are going to be out and about. Enjoy the cooler weather. Love you. I will talk to you next Friday. Take care. Bye-bye.